Good morning, Friday friends. We have a week that feels calmer than some other weeks, but never fear, it is preparing us for next week, which will be even more full of activity. And there was still a lot going on. So we're going to start with our Wisconsin stuff and move to Congress and then the administration and reconciliation bill in our current our typical pattern. And the main thing to know is this week in the legislature was actually very busy, but it was behind the scenes. Next week will likely be the last day that the state Senate comes together to have a full vote on the various bills that have already passed the state assembly. So this is kind of the last chance for a bill that still is live to go through the next step because each bill has to pass both the Assembly and the Senate to be able to advance to the governor's desk where he can determine whether to sign it or veto it. This is kind of the last chance of what is still living that could still be on a path to become law. And what happened this week is the members of the majority party in the Senate, which are the Republicans, they met together. They call that a caucus to decide which of the bills that is still in that long list. There's probably about 200 bills that have passed the Assembly that the Senate has not yet acted on, will be scheduled for a floor vote next Tuesday, March 17th. And if the bill isn't scheduled for a vote, it means the Senate likely is not going to act on it, and the bill will die at the end of the session. If a bill is scheduled for the vote, generally that means they believe they have enough votes to pass the bill, but not always. Sometimes there are bills that are scheduled where it's very unclear up to the last minute whether or not votes will happen. So, even when we get the list of bills that are on the schedule, it doesn't necessarily mean that they won't be pulled forward or that something that is listed won't be acted on. But it gives you a pretty good sense of here are the bills that they think they have enough support to pass. And generally, the state Senate doesn't, they don't publish their proposed list of bills until pretty late on Friday evening. So we're kind of talking about this ahead of time. There are kind of three main things that are still in play that impact people with disabilities, and we've talked about all of them before. So the real question is, will the bill that now includes food share funding, the needed money that will help Wisconsin implement all of the changes that are now required under federal law because of the passage of H.R. 1, will that pass next week or not? And there's another smaller bill that would make some changes to the Medicaid assistance purchase plan and let people inherit a lump sum without losing their ability to, their health care and their ability to stay in the program. And then there's also a bill that would let hospitals pick a decision maker for patients, which we've talked about before. So a couple of these are kind of, we're putting them into big buckets now. Out of the list of bills, here's the state Senate to-do list. They really do need to pass AB 180, even though it includes some policy changes that lots of people are not happy with. That is the path to getting the funding needed to implement the changes from H.R. 1 and to keep the SNAP program as error-free as possible. Remember, some of the changes from H.R. 1 actually started to be implemented in October. So we've had a pretty long time since last July and now where the necessary funding, to hire additional people with expertise to help make sure that all the new people who need to do prove your working requirements and extra paperwork know what to do. Those extra people help minimize mistakes. We haven't had those folks, and the changes have been in place really since October and then another set in December. So we are in the point where Wisconsin is kind of building up mistakes because we haven't had the money in place to hire the people needed to do the work. So next week, Tuesday, is a pretty big day. That either passes and that puts us on the path to being able to move forward with hiring and other things that need to be done while we're still, understaffed and accruing mistakes, or it doesn't pass, and that puts us in a position where, really Wisconsin is put at a much greater risk of having an error rate that is high enough to mean the state gets a lot bigger financial penalties, a little over $200 million if we had an error rate that was at the highest tier. So that's kind of this is a do or die moment for that bill, as well as AB 253. And I want to point out that AB 253 is not a bill because we've had so many big challenges. This is a relatively small bill, but it still means a lot. And it's been entirely led by a self-advocate. This is a person with an intellectual and developmental disability who took a problem to a legislator, and the legislator was convinced that, yes, there should be some solution and was friendly to the idea. And it is his doggedness that has kind of kept this bill on a path and put it in the position where it could become law. So even in this world of many, many changes, many of them not particularly helpful to people with disabilities and their families, it's a good example of there's still opportunity to do some positive things, and there's still an ability for one or two individuals with a little support to really move things forward if there's a willing member of the legislature. So the to-do list, these are bills, contact your state senator with your thoughts about them and whether the Senate should pass them. There's also a to-don't list. I guess we call it please don't. And AB 598 is the bill that we kind of have on this list. It is really unclear whether there are the votes in the Senate to pass this bill. The governor has conveyed a willingness to sign it. We do believe that it has pretty big impacts on people's rights and really opens up the pathway for financial exploitation and abuse. And it is not similar to any other next of kin law in the country. I can see that there have been some kind of media stories that the Trades Association has been trying to put out to kind of say, hey, this is, to advocate for passage of this bill. But it is a bill that is not the same as what other states do. And in fact, the differences are pretty significant. So at this point, it's really important for members of the Senate to hear from constituents about their concerns about this bill, to at least plant the seed that people are watching, and they will be watching next week to see how people vote if it's on the schedule. I have a couple of slides in here about these bills that we won't go over. You can refer to them when you get the after message if you need something to say in a message to the legislature. Next week, there's lots of things happening next week. So the 17th is the last day of the state Senate. And 2 days later, March 19th, is the annual Disability Advocacy Day that Survival Coalition, which is a cross-disability coalition of more than 20 statewide disability groups, hosts every year. So some of you are probably coming, and you may have registered. We'll see you there. Great. And if you are coming, you will know what the Senate did or didn't do, and that's something that you might be able to talk about in your meetings. So if there are things that they did on that list that you think are good for people with disabilities, you can say thanks. And you can also convey disappointment or opposition if they have voted on things that you don't think are helpful. if you can't come to Disability Advocacy Day, I've included several slides here that are the main messages that Survival Coalition has kind of said are important to send to lawmakers at this moment in time. Remember, lawmakers are leaving to go campaign, so we're trying to kind of put in their minds what are some of the big picture things that are really of concern for people with disabilities and their families. And if you're unable to come, think you can connect with your legislator next week and just say, hey, I'm not coming to this, but I want you to know that these things that they are going to be saying are important to me and also reflect my experience, and here's what my experience is. So Survival Coalition has chosen to emphasize the survey that we conducted late last year. And many of you may have participated in it or sent it out to your networks that really gets at, how many people are reliant on unpaid caregivers providing some amount or a lot of care to be able to get the care that they need. And what happens when people don't have care workers who are able to step in and fill in gaps. So we have this survey that, again, lawmakers are going to get to kind of emphasize how much unpaid family caregivers are already contributing. And I think it's important because if you've been with us the last couple of weeks, there's starting to be a narrative coming out of the federal government tying Medicaid and home and community, Medicaid fraud and tying home and community-based services as potentially fraudulent because there's higher spending. And there's also been some narrative of, well, wait a minute, unpaid care, like family caregivers can do these things. We don't need home and community-based services because these are things that your family can do for you themselves. And so having a message where families are saying, we are already doing all of these things, like the systems that we have are not replacing family members. They're at best a supplement, and they are not adequate to fill in when we are no longer able to provide care, is a really important message, not only because it underscores how important home and community-based services are and how delicate they are, but it also kind of shows or says that, we're already working and we can't do any more. And at some point we won't be able to do it at all. So do not fall for this idea that you can just stop funding home and community-based services and everything will be fine because families can pick up slack that they're not doing now. So the points that we're helping people understand, in addition to the survey that Survival did, is things that I think many of you experience in your daily life now. We hear about these things, all of the disability groups, all of the time, that unpaid caregivers are really relied upon for daily care. They're filling in gaps. There aren't workers to hire. And the unpaid caregivers are aging. These seem like very obvious points, but again, our role as advocates is sometimes to connect the dots on things that are obvious to us and make them real for lawmakers who may be not thinking about it because they're not in that position right now in their lives. It's also important to remember that this idea of, well, families should just be doing that, or your family can do that for you, that isn't necessarily true. There are lots of people who need care who don't have those family members they can rely on for lots of different reasons. And nobody should have to go to a more expensive institutional setting that also is suffering from a lack of care workers, to be clear, because there's an assumption by policymakers that there's some mythical group of family members that is available to take on and willingly take on and do a volume of unpaid work that is really professional level work. Because direct care workers are professionals. They do lots of things that are really important to people, even if they are not quite recognized. And I think a lot of family members have very clear, like the work that these care workers do is absolutely essential and needed and professional. And without it, you really run the risk of people not being able to live in the community. Um, I think it's also, if you are a family caregiver, um, there are lots of examples of how the lack of paid conditions and the lack of capacity for home and community-based services is having a ripple effect. It is taking people out of the workforce or reducing the hours and reducing career advancement. And I think those are actually really important stories that legislators don't necessarily think about. Again, you are connecting the dots for folks. They kind of look at a budget and say, well, this is an expensive line item. What if we cut so much off of it? And they don't necessarily see the impact of those cuts to a budget line unless we draw those conclusions for them and show up and say, hey, if I get less help than I have now, here's what it means. I have to quit my job, which means I lose health insurance for the rest of the family, which means I lose earning power. You can talk about impacts in financial terms and in ways that lawmakers understand, but they haven't thought about before. And I think the big takeaway that survival this year is trying to kind of give for lawmakers is home and community-based services are an investment that helps everybody. Those services provide jobs for the workers who do them all throughout the state. And it means that unpaid family caregivers can continue to work. And it means that people with disabilities who are well supported can work too. So it's kind of, thinking about it as an investment, not only costs avoided, right? Not only we're preventing a whole boatload of people who would be much more expensive to support in an institution from having to go there. It's also an investment that means workers in local communities have jobs that can pay them to do this work, and we keep people in the workforce who would leave otherwise, and we can get people into the workforce who might not have been able to be in the workforce without these supports. I'm not going to go through this slide, except to say that we know that the next state budget is going to have a lot of shortfall. And that is definitely what other states are already experiencing now. And this is probably going to continue through at least the next 1 to 2 budget cycles. The one number that has changed here, and it's not a surprise, usually the Medicaid budget does its best to estimate, based on past claims, what they think the cost of all of Medicaid is. And remember, for most states, about 30% of their state budget is Medicaid. So it's hard to get it exactly right. It's healthcare for 1.2 million people, and some of those people are in long-term care programs, either in nursing homes or home and community-based services, which tend to be higher cost. So it isn't uncommon that what the department maybe estimated what it would cost to run Medicaid is off slightly because, again, people come on and off the program. They need different things. The price of drugs goes up, all sorts of cost drivers that are hard to predict. And the shortfall for Medicaid is continuing to grow. It was at 214 million in the first quarter. Now it is up to 369 million. Again, in a program that spends, billions of dollars, that isn't that much difference. But in a budget that has to be absolutely balanced, $369 million shortfall is a big deal. coming into the next cycle. And it's kind of additive to all of these other things that we know are going to be, either unknowns or additional shortfalls. Congress. There's been a little more activity this week, even though the House was out. The Republican members of Congress all were doing a policy retreat this week. And generally, those retreats are kind of a big meeting where they discuss what are the ideas and priorities we have, what do we want to do with the rest of this session. And on Monday, the president said, I won't sign any legislation unless you pass the Save Voting Act bill, which we have talked about in a couple of previous webinars. And that's a bill that would really try and assert some federal, impose some federal requirements on all states on how they run elections, which have always been a state function. And there are some provisions in the SAVE Act that lots of advocates believe would mean that people who can vote now would have a harder time doing so, and people who are registering to vote might have a harder time doing so. So not only did the president say, I don't want to sign anything else unless that voting act or that Save Voting Act passes, but I want to change the Voting Act to add more things, including a near total mail voting ban. Many people with disabilities and older adults use mail-in voting, and there are several states that have exclusively gone into using mail-in voting as the primary way people vote. So there are some senators who are like, wait a minute, this is working okay for my state. I don't like this new idea. But certainly the president has been conveying that making changes to how voting is able to be done and making new requirements for voters should be the number one priority for Congress. Importantly, the House didn't commit to, they've already passed, 2 elections overhauls bills that may not have enough support in the Senate. And so they didn't commit to doing the changes that the president wants or commit to doing another bill. And there are certainly Republican senators who did not like the new ideas that the president proposed. However, the Senate Majority Leader is planning a way to try and hold a vote on the SAVE Act. And it's probably going to be next week, and it will be a painful experience for us all. There's been a lot of discussion in the last couple of months to bring any bill to the floor for a Senate vote. You need to have 2/3 of the chamber agree to do it. And that means you have to get 60 senators to vote yes to bring any bill to the floor. It's called the filibuster. And what it essentially means is that a large majority of the senators have to agree that this is a bill worth having the whole body vote on. And again, remember, generally when you bring a bill to the floor, you're doing that because you think it has enough votes to pass. So it's kind of a way for the Senate to kind of set a high bar with very limited floor time on we only are going to vote on bills that we think we can get done. And there's been kind of a lot of debate in the last couple of months about should we eliminate the filibuster? So it's only a simple majority of senators that have to agree to bring a bill to the floor. So instead of 60 votes, 50, because there's 100 total senators in the chamber. And that would mean it would be much easier for many bills to get enough votes to be on the floor. It also would mean that whatever party has the majority would have a much easier time scheduling lots of bills for floor votes. And the Senate has traditionally and now been very reluctant to remove the filibuster because, as we know, who is in the Senate changes and who is in the majority changes. So there's real fear that if you eliminate the filibuster to get a piece of um, legislation passed now, that will make it much easier for the other party, whenever they would be in power, to move other pieces of legislation that maybe the minority party wouldn't like. There's also been talk of a talking filibuster. And this is kind of a third approach that the majority leader is doing, partially because the president has just been very clear he wants to pass this act. And the Senate majority leader is being very clear that he does not think he has the votes to get it to the floor and pass it. So what will happen next week is the Senate Republican leaders are going to try and bring the SAVE Act to the floor, and they're actively planning for many days of debate that could stretch well beyond next week. And part of the strategy here is to make it really hard, right? That you could have all sorts of tactics that are being in play to make sure that the minority party has enough people always present to prevent the bill from having enough votes to come to the floor. And eventually, after all of that, it's expected that the Senate will end the debate at some point without ending the filibuster, which will mean that we will have the 60 vote threshold in place, bring the SAVE Act to the final for a final vote, and it will guarantee its failure. So this is potentially a lot of gnashing of teeth over this bill to get to a failure point. And it's perhaps political theater, but it's also political theater over a very important bill that could really make it much harder for lots and lots of people to vote. And you never know. Sometimes strange things happen. So the fact that we're going through this process means it's a process to watch. Also, at the policy, we keep coming back to, is a second reconciliation bill dead or not? It's kind of like a zombie movie where you think everybody's down, and then there's like a hand that goes not quite yet, and then you go through the process of wondering whether or not we've defeated the zombie bill. A second reconciliation bill is still being considered. And again, this was a topic that was at the policy retreat. It seems like there's interest in the idea of a second reconciliation bill, but not a lot of plans about what to put in it. However, now you're starting to see senators pitch some ideas about what the bill could include, which some people who are watchers see as some signs that at least there's some testing of the waters of what could be in a second mega bill. And it's unclear whether, the very slim majority that the House has would be sufficient to pass a bill only with Republican votes. But I think it is important to kind of see what are the ideas that senators are starting to pitch as being included in that bill. And there's two that are important. One idea is to essentially deepen the changes that were included to SNAP and HR 1 and increase the penalties states have to pay if they make too many mistakes. This idea that was put in place for the first time in July, where states have an error rate, and based on what your error rate is, the state has to pay a financial penalty to get the other part of the federal money. This would add on to that idea. And you can see that the projection is this provision would mean that should be billion, sorry, not million, 80 billion more dollars to the federal government coming from states whose error rate is too high. There's lots of folks that say that provision is going to be really difficult for states already, and it may in fact be the difference between states participating or not participating in the SNAP program. Doubling down on that same idea, puts additional pressure on states that might already be having trouble figuring out how to meet the new requirements in HR 1. Again, it hasn't happened yet, but it's a good idea, it's good to know what the ideas are. The other idea that was floated is to put some of the Save America Act language in the reconciliation. And even though the reconciliation bill is supposed to be floated on budget, or is supposed to be focused on budgetary items, this particular senator said, well, we have really creative people that can figure out a way to write it. So, we could figure out a way to put some of these changes that would impact voters into this larger bill. Also happening next week, the House Energy and Commerce Committee, which is the committee that has jurisdiction over Medicare and Medicaid, is holding a hearing specifically on what is CMS able to do to go after Medicaid and Medicare fraud. Last week, we talked about a hearing from a subcommittee of this group where the CMS director came and essentially said, hey, we think there's some high spending categories or services that have an increased line of spending. And he specifically was talking about home and community-based services, personal care, home care, NAMT, mental health and substance abuse services, all services that primarily serve people with disabilities and older adults, and applied behavioral therapy for autism, as services that had high potential for fraud. Those were also the services that were identified in a Paragon Institute report a few weeks ago. And after that hearing, the subcommittee sent letters to multiple states asking for lots of information specifically about many of those services and the state's fraud prevention techniques. So this is now another hearing between of the full committee, and you'll be able to watch it live. It happens to be the same day as the end of the state session, state Senate session. So if you want, wall-to-wall coverage, you can set up a computer and watch Wisconsin Eye and watch what the state's doing. And you can set up, your YouTube and watch what the Congress is doing, or you can pick one or the other, or you can save your sanity and hear about it here next week as we kind of figure out what has happened. But I think what people are going to be watching for in this particular congressional hearing is what is the majority party's narrative? Are they reinforcing some of the narrative we are hearing from the administration on, yes, we think there is Medicaid fraud just based on how much we spend on something and what it is? Are they going to push back on that? And for members of the committee who are from the minority party, are they going to be able to ask good questions and kind of point out any flaws? Many of us feel like we might already know the answers to those questions, but I think this is an opportunity to kind of see in real time and in public forum, what are people asking about? What is the message that this committee really wants to send about Medicaid fraud and what they think about what CMS is doing kind of as a federal agency unto itself to states, which has included deferring and not paying reimbursement requests in the case of Minnesota. Congress also has some other things going on. The Department of Homeland Security remains partially shut down because the federal 2026 budget for that agency was the only agency not passed. And there doesn't seem to be a sense of urgency to address that issue. This week, the Transportation Safety Administration employees, the folks who check through all your bags at the airport, they're missing their first paycheck this week. So there are actual real consequences for real people for this funding lapse. And it doesn't seem like there's a timeline to address the budget for that agency at this point. And again, we're still waiting on the president's budget, and the federal 2027 appropriations process is starting. So moving on to things happening in the administration. In July, we covered an executive order that the president issued that was calling for use of civil commitment, guardianship, and involuntary commitments to primarily to remove homeless people into long-term institutional settings. And this appears to be at least being tied to that idea. Now, it's important to note that, guardianship proceedings do have to go through a court process, and there is court oversight. However, this is kind of I wouldn't say new approach, but it is kind of a sign that, thinking about guardianship, which is really a restriction of people's civil rights, as a tool to move people from one place to another. And sometimes, whenever there's somebody who feels like they can make decisions they want, if they are appointed in this position, or that there are certain groups of people who shouldn't be able to make their own decisions because it would be easier or more administratively convenient for somebody else to do so. People with disabilities get real perked up on that, because as soon as you lose your ability to make your own decisions, it means somebody else is doing that for you. And they may be making decisions that the person does not want and has not a lot of recourse to oppose or control or get back. So interestingly, this particular piece is about the Veterans Administration, and it is trying to move veterans without family where nobody else can kind of fill in. That is a situation that happens to a lot of people, out of the Veterans Hospital to somewhere else. So for those of you who've been following AB 598, it is very much an approach to a similar problem where you have people in one kind of setting and they would like to move them to another. And in this case, this would actually be a process that would be better than what 598 does, because 598 avoids any court oversight at all. So in this case, at least there is somebody appointed and a court that's making an evaluation and some recourse and oversight of the guardian. But the same idea of we want to move people from one place to another and seeing guardianship as a mechanism to do that is here. And again, major kind of the national folks are saying, that's, there isn't a place necessarily to move these folks because there isn't enough home and community-based services. So it's, again, something to watch, especially if we start seeing a larger pattern on other things. Continuing with veterans, the Department of Veterans Affairs is also now launching an automated fraud detection tool and is planning to scan about 1 million disability benefit for questionnaires for what it considers evidence of, fraud, essentially. And this is important because what it's doing, the questionnaires that it's looking at are really about documenting the medical evidence that determines a veteran's disability rating, and that determines their monthly compensation. So this is actually a really important document when it comes to how much how much money are you getting to support you in your disability. And there are lots of folks that are pretty worried about how this will play out. So the AI tool is looking for signs that medical evidence was, exaggerated or invented, and then it's going to flag those records. Importantly, it's also flagging records that list a non-Veterans Administration professional, and especially with if they have an address that is more than 100 miles away from the veteran's home. That may not seem like a particularly, that may seem suspicious. However, the Veterans Administration, just like many providers, suffers from a lack of people who are able to provide those evaluations. And many veterans live pretty far away from a VA provider. They, so how unusual it is to be more than 100 miles away from a VA facility. I don't know the answer to that, but I do know a lot of veterans live all over, and that, it's quite conceivable that they're more than 100 miles away from a VA hospital, depending on where you live. And because there's been a shortage of examiners and it can take a long time to get an appointment with the VA, many folks have used other medical folks to kind of get the documentation needed about their health and other conditions that lead to disability. So there's some questions about, will it identify the right things? And then questions about, will this AI tool actually identify things that turn out to be real fraud? And lots of people are worried that the disability ratings and people's benefits could be changed based on the suspicion of fraud alone, as opposed to actually figuring out, like looking at the documents that are flagged and then conducting another independent evaluation to determine what is actually true. And I think for our purposes, the reason our interest is piqued here is because if this is a process that is being used with this group of people to identify whether or not they're disabled enough, or that whether or not, the doctor made a mistake or whatnot, it could be used for other processes too. And that can have a big impact downstream. The what is in paperwork becomes extremely important if you have a scanner looking for certain things, and maybe if they're looking for certain things, they don't see the whole picture, or there may or may not be a real robust investigation of things that are flagged. The CMS director, Dr. Oz, has now moved to looking for fraud in New York's Medicaid program. So the CMS has written a letter to New York, and looking, flagging again the high number of people who are receiving personal care specifically. So again, this is another example of looking at specific kinds of spending and specific kinds of services that primarily serve people with high care needs, who are people with disabilities or older adults, and saying, hey, that high spending and this particular service we think is an indication of fraud. So lots of watchers are wondering if this letter is going to be kind of a pre-step to additional action from CMS that might directly impact payments being made to New York State for Medicaid. In the same vein, the CMS director is also saying, hey, I think there's too many people who are enrolled in the Affordable Care Act. And because I think there's too many people enrolled in the Affordable Care Act, I think that many of them are enrolled fraudulently. He seems to feel that 23 million people in the Affordable Care Act is too many, that there should be lower. That there has not been a mention of how many fewer people he thinks should be in the Affordable Care Act. We know that almost 1.3 million people dropped out of the Affordable Care Act marketplace this year alone. And partially that's because of changes in H.R. 1, the expiration of the ACA subsidies that Congress did not extend, and other administrative rule changes that have all been projected by experts to result in fewer people in the marketplace. We also know that the current number of people in the marketplace is likely to be revised downward again because some of the folks that signed up maybe hoping that Congress would extend the subsidies, are now faced with they can't pay their bill. And you only get so long grace period before you lose your coverage after you can't pay your bill. So a lot of folks have been looking at April, which is coming up, as being another point in time where we're likely to see more people drop off of the Affordable Care Act marketplace. So he is telegraphing that he thinks enrollment will fall further, which he's probably right, but it's for all of these reasons that I just talked about, not because they're fraudulent. So it's kind of like he's projecting a drop in enrollment that will likely be true, but it will not be for the reasons that he is talking about, which is assuming that there is a lot of fraud. And specifically, the fraud, like what does he mean by fraud? Again, the Paragon Institute, which you may remember just released a report, kind of targeting home and community-based services, NEMT, ABA therapy, mental health, services that are essentially high cost because the people who use them need them continually over time. And that are decentralized because they're generally offered in people's homes. The Paragon report, the Paragon Institute also made some claims about fraud in ACA enrollments, and that has been picked up by the administration. So when they talk about fraud, they mean, people who are enrolled by mistake or somehow got duplicate coverage or received tax credits that they didn't qualify for. And interestingly, for as much of a target as Medicaid is for fraud, it's interesting to see when the CMS director is talking about potential fraud in the ACA marketplace, he's also saying, well, these people who are in the marketplace who I don't think should be, could be in Medicaid instead, or they could get a job with insurance. So it's like it's a kind of strange way to be both worried about fraud in Medicaid and then worried about fraud here, and then saying, well, you could get a job with insurance, or maybe some of these people who I think are fraudulently in the marketplace should be in Medicaid instead. The Paragon Health Institute estimated that 4 to 5 million people were improperly enrolled, which again can be for lots of mistake reasons. Other health policy experts say, there's a scale of mistakes that's very different. And we think that the mistakes they're talking about are probably a few 100,000 cases, not millions. So again, this is an example of, are there some mistakes? Are there some people who are in a place that they shouldn't be or are getting extra tax credit they shouldn't be? Yes, probably. Is it the majority of people, of the 23 billion people in the Affordable Care Act? No. Is it even the amount that this think tank thinks it is? Probably not. Is it a reason that might be used to make changes to the ACA marketplace that could result in many fewer people being able to be in the marketplace? Possibly. Because if that the narrative is driving some policy changes here. Also thinking about narrative, in September, we did a lot of coverage over some of the comments and different things that had been talked about by Secretary Kennedy and also President Trump on autism. And you may remember that one of the things the president said was to link acetaminophen, known by the brand name as Tylenol, as being a causal reason for people getting autism. Like if pregnant women took this drug, then the likelihood that their child would have autism was higher. That was what the president said. That is actually directly contrary to all of the scientific studies that are on that have been done on Tylenol. It's been a very, very widely studied drug, and it's one of the few drugs that is considered safe for use during pregnancy. And it's not only a pain medication, it's also a fever reducer. And that is a very important thing to be able to do because when pregnant women have a high fever, sometimes due to a virus or other things, that can have a real impact on an unborn child. So this is just an article that's kind of saying, hey, words matter. And even though doctors and scientists very quickly countered, the statements the president has made, there was an almost immediate change in behavior, both by practitioners and probably pregnant women, where 10% decline in use of acetaminophen in emergency rooms in pregnant women, no change for women who weren't pregnant. And it's a reminder that the narrative that we're hearing, which is now a lot on Medicaid fraud, has a real impact on what people do and what they think. And in the case of Medicaid, if you have providers who are worried, who are starting to wonder and not trust whether or not the care they provide and the reimbursement they submit will result in them getting paid, you can kind of see that, without too much action, it's going to mean that there will be some folks that will be reevaluating whether or not they want to take on a higher needs Medicaid patient, or whether or not they diversify who they're serving, or if Medicaid payments become a risk, it really won't take that much to really disrupt the services that people need. We was on a different call this week about SNAP, and we've been talking about AB 180. It passed the assembly. Lots of people are not the experts you are. So a lot of people heard, hey, it passed the assembly, and they thought it was law, right? Because they heard it passed, but they didn't remember that it has to also pass the Senate, and it also has to pass, it also has to be signed into law. So the fact that it passed one step in their minds meant it's already passed. And there were some, anecdotal reports that people were changing what they were buying, or retailers were not selling certain kinds of products to people on SNAP because they had heard that this change had happened, even though it hasn't yet. So I just think that's important for us to remember, is that as much as we're hearing about fraud, that drumbeat is actually a strategy. It's a strategy to move forward policy, which means that it's really important that all of us are talking about how important community-based services are, who's in them, why they are high, there's high usage of them, and why they cost more, and why that money is really worth it for the state, for the people it serves, and for their families. Continuing with autism, we covered this panel again in September and November. I think the important thing here is that this is an advisory group that was mandated under federal law. And in the past, the advisory group has been made up of people with real expertise in the field and advocacy organizations. And the current secretary has replaced all of those people with new people, many of whom are kind of known for promoting a discredited idea that autism and vaccines are linked, and or who have advocated for treatments for autism that have been dangerous or lacked evidence. And I think the important piece to see here is not only has this meeting been canceled again, so it's really unclear what's happening to this $2 billion in federal autism funding that this group is supposed to be advising on spending. They're what's happening. We've had lots of examples where the federal government has spent money in ways that maybe Congress hadn't intended. And here's a body that's supposed to be overseeing the spending of certain money that isn't meeting, and where all of the members have been replaced. And I think it's also an important reminder that even when the autism community works and gets past a federal law that looks like it has some oversight and parameters, that oversight is only as good as the people who are in charge of setting it up want it to be. We have also talked about in the past the HUD, which is the Federal Agency for Housing and Urban Development, wanting to propose a administrative rule that would let public housing authorities and other essentially landlords that offer housing assistance units to be able to impose work requirements and time limits on how long somebody could stay there. So there was some backing off of that idea. It's back, and now in a very formal way. The agency has proposed a formal federal administrative rule. There's a public comment period that's open until May 1st, and there's a link in here if you want to submit comments. And really what it means is, again, this idea that raised quite a bit of concern some months ago hasn't ever gone away. And now it's resurging itself, at a later point in time. And what it means, the Justice and Aging has really been following this at the national level. What it means is that there are a lot of people, even if they would be exempt for some of these restrictions, especially older adults, 62 and over, and people with disabilities. Again, it's an example of you have to prove you're exempt. And what do you need to do to prove you're exempt? Justice and Aging and other housing advocates are worried that, even if you are not subject to these work requirements, you could still lose your existence if you don't complete whatever the new administrative barriers and red tape are going to be to prove your exemption. And there's certainly a lot of people who might be in that category where they're a little too young, but they may have conditions that make it harder to work. And maybe they're not, like, what qualifies as disability is, maybe they don't quite qualify as disabled, but they have a lot of, underlying conditions that make it pretty hard for them to work 40 hours per week. Those are the people who are going to get caught and be neither fully exempt from the requirements and also not able to fully meet the requirements, and the penalty will be to lose their housing assistance if this goes through. Moving to the reconciliation bill, if you want like a cathartic blog to read, Justice and Aging put out a blog that said, hey, we were told this wasn't going to impact the populations of people we care about, older adults and people with disabilities. But we all knew that that wasn't true at the time. And we think lawmakers probably knew that too. So again, we've covered a lot of states that are now starting to make decisions. There's a list of them here. A couple of states we haven't covered, but most of them we have. And, it's a reminder that we spent the last year telling federal lawmakers these things would impact us. And now the shift has to be state by state, where we have to insist again to state lawmakers that these cuts are um, are coming at a time when the new narrative is the cuts are okay because we're rooting out fraud, waste, and abuse. No, cuts are cutting care, and I think that's where the next fight in the next couple of years is going to continue to be. In Connecticut, we'll add to the list. Connecticut's governor is proposing to end a Medicaid program called Community First Choice in the next state budget. And that is, again, a program that is specifically for people with disabilities and specifically for people with disabilities who need help at home to stay out of a nursing home situation. 7,200 people in Connecticut are currently in that program, and they are not trusting that when the state says, hey, you're going to, if you're in the program now, there's a different program that we can put you into, and you're not going to lose your services. A lot of the folks with disabilities are pointing out, like, these other programs, do they offer the same thing? Am I going to get the same thing that's helping me stay out of nursing homes here in a different program? And also, you're putting me into a waiver that has different requirements, and a lot of the Connecticut's waivers have long waiting lists. What's the plan? So disability advocates are, again, being forced to ask the right questions to people in power to say, you're talking about eliminating this like it's a budget line, but where's the guarantee for us that the things we need to get the care we need are going to stay the same, and you're not putting us at risk of either losing our care or ending up on a wait list or ending up in a nursing home? We'll have more news on Idaho. This is a continuing saga next week. Idaho is still figuring out, how do we cut Medicaid? The governor proposed totally eliminating home and community-based services. There's another bill that's proposing to take those cuts solely in residential habilitation providers. And it kind of seems like a shell game where they want to reduce pay raises that the legislature approved in 2022 but never happened because of a court order. So I'm not quite sure how that works out. Also included is a requirement for audits on payments. Again, this fraud, waste, and abuse narrative is coming into play in some of these state bills. And while the purpose of the bill was to cut funding from these providers, the mechanism is a little unclear on how they're going to do that, right? Because you're kind of cutting money that never materialized for these providers. The bill authors were saying, well, we can make these cuts and it won't matter. Nobody's going to close or whatnot, because, the rates that they have now are higher than they were 4 years ago. I bet you if you talk to a lot of service providers, some of whom have always felt like the rates were not sufficient to meet the actual cost of care, if they looked at their rates from 4 years ago, even if they were lower than they are now, I bet you that the providers would say the cost of doing business over that 4 years has gone up. So just because the rate is higher doesn't mean your costs aren't also increasing. And I think this is a line of logic that we will hear a lot from lawmakers, that's important to kind of push back on, because there's an awful lot of kind of looking at the top line of numbers and saying, well, these people got something at this point in time, so they could afford to get less now. And the reality is that's not how this works. Providers are in the real world in real time right now with the costs and the workforce that exists right now. And historically, what their rate was 5 years ago is not necessarily sufficient to meet what the world is right now. So I think it's pretty disingenuous for lawmakers to say, we can make cuts and you'll just tighten your belts and be fine, especially in a system that is very fragile and delicate, where lots of families are saying, I can't find all the care that I need. I'm providing care myself. And even if I have care from a provider, sometimes the workers that they have don't show up and I have to fill in anyway. California, again, a different population of people, but some of the most vulnerable folks will be hit first by prove you're working or exempt requirements required under HR1. And that doesn't mean that other populations won't be hit too. So we're kind of we're in this place where we're seeing the first impacts now, and we should just understand that those impacts will continue to widen and hit more and more people. This article was focused on the homeless population. And again, there are lots of people within the homeless population, about 180,000 in California, who on paper would likely meet the exemptions to the work requirements. But here's the kick. To claim an exemption, you need a doctor to certify it. And only half of the homeless folks in California regularly get care, and only 39% have a care provider. So that becomes that requirement to prove that you're exempt becomes unsurmountable for, at least half of those 180,000 people right away. This is also a group of people, and I don't think this is dissimilar from a lot of low-income older adults and people with disabilities, frankly, who don't have phones or internet so if they couldn't prove that they're exempt, getting a job is also made more difficult because of these other barriers. Access to technology, access to food, access to, hygiene that is expected in many workplaces. And of course, folks who have other co-occurring conditions, like mental health or addiction, that adds on to the layers of what makes it difficult to be able to find and keep a job if you can't prove that you're exempt. So this article is being really clear about, yes, there's an exemption that many people in this population would qualify for. And we're expecting that there are lots of people who would be eligible for Medicaid who are going to lose it because they won't be able to prove their exemption. Up to 90% of the people in LA who are homeless. Which is a pretty big proportion. Moving to Florida, Florida is one of 10 states that did not expand Medicaid. When we talk about expanding Medicaid, we mean using the Affordable Care Act authority to allow certain populations of low-income adults who earn up to 138% of the poverty to qualify for Medicaid. Wisconsin also didn't expand Medicaid under the Affordable Care Act, but we cover some of that population that is allowed in the Affordable Care Act in the Badger Care waiver, and we don't allow them to earn up to 130% of the 8% of the poverty line. We only allow them 100% of the poverty line. So the waiver that this population of people is in the Badger Care waiver, which means for us, we are subject to that population of people within the Badger Care waiver is subject to the new work requirements under HR1. Florida just flat out didn't expand at all. So they are in a position where they haven't expanded coverage for anybody through a waiver or through the Affordable Care Act, but they want to impose work requirements anyway. And just to kind of give you a sense of, when you get policies that become popular that states kind of want to copy, it doesn't always work out the same way based on how this current system state have. So in Florida, and it's unclear if this is legal for Florida to do this. Again, we've seen a lot of lawsuits challenging various things, various bills. This hasn't passed yet, but it's a communication of intent. This idea that your health care should be tied to whether or not you're working, no matter what your income level is. In Florida, if you're a working age adult and you don't have a disability, you pretty much have to be caring for a child or an older or disabled family member, and you are limited to earning 26% of the federal poverty level. That's $592 a month for a family of three in order to get into Medicaid. That's a really low threshold. The fact that there are so many people who qualify for that should be a very big wake-up call for policymakers, because it means there's a lot of really, really poor people, right? And if this proposal were to pass, it means that a lot of the folks that are currently meeting that very low income threshold to be able to stay in Medicaid would probably lose their health care altogether, because the income limit is so low that if they worked, demand, 80 hours a month, they'd exceed the income eligibility limit, but they wouldn't earn enough to qualify for any kind of subsidy on the Affordable Care Act marketplace. So, we have, and in this state, we've talked a lot about, a lot of our very low income people who are just over the threshold for qualifying for Medicaid are also the people who have the hardest time affording a marketplace plan. This is the same situation, except it means a whole group of people is actually left in limbo, not being able to qualify for Medicaid because you have two requirements that are essentially making it impossible to do so, and also not earning enough to be insured any other way. The impact of the changes for HR1 are starting to hit states. This is specifically about New York City, but it's a big city with a lot of population of people, and about 30% of the city relies on SNAP for food. The new requirements for HR1, the working requirements, took effect in New York this month. And so now this is another group of people who has to prove that they are working or volunteering or in a job training program enough to be able to get SNAP. And that is going to mean that probably there are quite a few people who qualify for SNAP that won't be able to meet the administrative burdens and will lose their access to food care. A lot of food hunger advocates are really worried that people who want to find jobs aren't able to do so right now, that the market and the positions that are open are pretty, it's not a good time to be looking for a job if you're in New York City. So that means that if you have people who aren't currently working enough, their ability to find a way to work more or to get a new job or a second job might be pretty limited. And if they can't do that, they will end up losing access to SNAP. In other SNAP news, there are other states that have passed either statutes that restrict what the kinds of products that people can buy with their SNAP benefits, or they have asked the U.S. Department of Agriculture for a waiver to be allowed to put those restrictions in. So kind of two pathways to the same policy, which is if you're getting SNAP benefits, we feel like we should be able to control what you can and cannot buy with them because there are public dollars. So five food stamp recipients in 5 states are actually suing the U.S. Department of Agriculture now over those restrictions that are being imposed through USDA waivers. And they're arguing, that these limits are unlawful, and they're going to make it harder for people to know what they can and can't buy, and that some people might be using some of these products as a way to manage their health. And there are folks that have different kinds of conditions where you might need a sugary drink to regulate blood sugar, for example. Other things like that. Like there are reasons people buy products that maybe some of us would not consider the best health choices because they're actually making a healthy choice for them because of an underlying condition. So there have been waivers approved in almost half the states in the country that will allow states to ban SNAP participants from using these benefits to buy soda and energy drinks and other things. And this case is kind of testing, can the USDA issue these waivers? I think it's a separate question about whether a state that has passed a law doing these restrictions, is that the same? Because states are often, when laws are passed, states are often directed to ask for a waiver from USDA to do these things. So yet again, adding on to the top of the legal heap of ongoing questions that are unresolved. In the meantime, until somebody says, no, USDA, you cannot do that, these policies are in effect in 22 states. And then finally, for those of you who are like, I can't get enough webinars, I really want more than a weekly webinar here. This one might be worth your time. We've talked a lot about what the cuts to Medicaid will mean for state budgets, and that states have relatively few options. Most watchers don't think that states will have enough money in their coffers to simply make up the decline in federal funding support. And many people also think that states will be reluctant to do things like raise revenue too much to backfill these new costs. But it is worth talking about because, again, if states are committed to only using cuts, they really only have four choices. They only have the choice to make people who are eligible wait, change what services are offered, change who can get in to those services, and change what those services are paid. And so those are, and they can make administrative changes that kind of change what people's individual care plans are and kind of try and drive costs down. And we've seen the examples of that across the country at this point over the last several months. But raising revenue is another option. And there are some states that are trying to do a combination of cuts and raising revenue. Lots of states have done tax cuts, which are revenue reducers in the past few years. And this webinar is pointing out that, one way to address these problems, we shouldn't ignore the idea of raising more revenue, and figuring out there are different ways to do that, to offset these cuts, or to undo policy choices that we made before, to reinstate some of the revenue generating ideas that states have used in the past. I do think that this piece of Medicaid accounts for 30% of state budgets, really important. Home and community-based services, which are optional under federal law, account for 32% of all Medicaid spending. This is why folks are honing in and targeting those services, because if you're in a situation where you need to balance your budget, it is an easy thing to look at what costs you the most and just cut that, right? 86% of optional Medicaid spending supports older adults and people with disabilities. So we should have no question with those three data points of who is going to end up being targeted in a situation where you have a huge part of the budget where a good part of the spending is being spent on two populations of people. Any cuts to those services are going to impact those populations of people. So if you wanted to see that webinar, it's certainly available. And there are now webinars coming out all the time that may be beyond your nerd threshold, but if there are some that we think are accessible, we will continue to share them.
All right. And one question regarding the decision maker bill for hospitals. Do you know where the Senate Democrats are standing on the bill? And then are there any Republicans opposing it?
I think it is critically important for every senator to get a strong message about this bill. I do not think that we should assume that any member of the Senate is either opposed to the bill or supports it unless we get an actual answer. I do think that, this is insider information. It is unclear if this bill has enough only Republican votes to pass it. There are a couple of Republicans that are opposed. There are a couple of Democrats that seem to be supportive of it. There were lots of Democrats who voted for this bill in the Assembly. So this is one of those issues where
Don't assume.
Yeah, don't assume. And we should never assume. Like, we should
Right.
never assume one party is either supportive or oppositional to disability issues. I think that's a lesson that we need to continually emphasize. I think sometimes there are parties who assume they know who is with them, and sometimes they assume that they can do whatever they want, and because they think a population of people has no other party to go to, that they don't need to take them as seriously. I would definitely reach out to any Democratic senators with your opinions.
And then someone did ask about the DVR, the status of DVR. And
Yeah.
I did put in there, it still has not been taken up by joint finance. We did get information that there were, I think, over 4,500 people on the wait list now. If they were to fund it by April 1st, DVR believes that would take at least until the end of the year to clear those people on the waiting list. And, they add about 1,000 people a month. And so DVR does believe that that joint finance does have to take this up because it's an emergency request, but we have not seen that. So I don't know if you have any advocacy strategy there, Tammy.
I can tell you that Joint Finance did meet this week, and they met this week to consider any bill that has a fiscal component has to be approved by Joint Finance. So you will often see Joint Finance have a meeting to approve various bills that the Senate might want to vote on. This week they did that for a number of bills. AB 180, the food share bill, was on that list. The kind of meeting Joint Finance has to call to approve agency requests like this is a 1310 meeting, and that stands for Wisconsin Statutes Section 13.10. They did not do a 1310 meeting this week. They did one the week before, and this request was not on it. So next week, I think, is really important because we think that Joint Finance would be far less likely to meet after next week. I did have a call this week from somebody in the central northern part of the state who had spoken to one of the representatives who's on the finance committee. They have been hearing about this request. So for those of you who have been making calls to finance members, they are aware. But it seems like the decision about whether or not to put this on the list for 1310, the committee members are trying to say it's not our decision. Maybe it's the chair of the committee's, the co-chair's decisions. And they're not being very clear about whether or not they are going to choose to take this up or not. So I think strategy wise, if you've made a contact before, good idea to check in again and say, hey, where is this? And kind of demonstrate that you understand that, the time is short here. I think the points that Sally made are good things to follow up with, to say, hey, there's already, I think it's actually 4,700 people that are currently waiting, to follow up and say, there's now this many people waiting, and we're being told that if they got the money by April 1st, it would still take them this long to go through that many people. And we keep adding 1,000 people a week. That's a good way to communicate urgency on action. If you haven't contacted them yet, I think it's now is the time to do so if you've been contacting them on other things. And I don't have a clear sense of what the finance committee is going to choose to do or not. But it seems like the decision is really with the co-chairs as to what they put on that 1310 meeting.
Mhm. I put a link in the chat. I think people can see the chat. With the link to joint finance if you're looking for who those members are. So that link will get you to their joint finance page. All right, that's all we got.